Communication is a key process that occurs frequently in health and social care. It is one of the most important skills that you will develop throughout your course, your training, and your career. It is essential that you get it right and that you improve the skill, as so much is at stake if you are unable to communicate with others. So what is communication? Communication in its simplest form is a method of sharing information between people. Information can be ideas, thoughts, and opinions. To communicate with others, you need to first have an idea or a message, and then transmit this to someone else. Communication is a two-way process involving both a sender and a receiver. If the message is received well and the person understands you, then they may participate in generating another idea and send another message back. The idea that messages are sent and received is really what communication is about. You will discover in this unit that there are some theories about how communication happens, but for now, let's think about when we need to communicate in health and social care. Doctors, nurses, social workers, physiotherapists and many other health and social care professions communicate with people every day. This includes colleagues, friends, service users and their families. This style of communication will change depending on what the message is and who it is intended for. Between friends, a type of communication that is often sent between people is informal. This means that the language that is used might involve slang words that both people understand. Informal communication is often used in less serious contexts or when a relationship has been formed. Formal communication, on the other hand, often involves messages of a more serious nature. It usually involves a relationship between people who are unfamiliar with each other, and quite often that involves professional boundaries. For example, the relationship between doctors and their patients will be quite formal and the language used will reflect that. There are many reasons why formal and informal communication is used in health and social care. Doctors and nurses may need to share information with each other to help the doctor make a diagnosis for the patient. Nurses may use a jargon-free language to inform service users about their disorders or to help them answer questions during a nursing assessment. This jargon-free is often informal. It is not uncommon for nurses to ask service users about their toilet habits by using the phrases number 1 or number 2. Jargon, including medical or social care terms, are often shared frequently between colleagues in health and social care. This type of language is universal and is usually learned during training as well as in the workplace. Through using this type of language, it ensures that the same definitions are used by the professionals involved, and everyone understands what is being said. The words used are much more concise. Communication can happen between two people or in groups. There can be problems in either situation if people receiving the message don't understand what has been sent. Throughout this unit, you will learn more about what factors can influence how messages are received and the types of technologies that exist that can help everyone be involved in conversation, even if they have communication difficulties. It is essential you know the best way to communicate with others, to find out more about how people are feeling, to find out if medications are working or if other treatments are working, or to inform and advise about conditions, are a few examples of why communication should be important to you.
Created using Powtoon.